So, for more on the rollout of COVID-19 vaccines, we're now joined via Zoom by the Department of Basic Education spokesperson, Mhlanga. Thanks very much indeed for joining us. Always good to talk to you.
Yeah, Peter, good evening. Thank you so much. Great to be here.
All right. So, you're trying to avert disruption. What does that mean? Is that more important than kids' safety?
Peter, we are trying to avoid disruptions because exams are around the corner. We know that the grade 12 candidates are writing the National Senior Certificate from the 27th of October. But we also know that the vaccines have side effects, and the side effects affect different people in different ways. Some have had to take days off, and others are able to continue with the normal business. But in the situation we are in right now, learners, particularly the grade 12 candidates who are going to be writing the exams, we are trying to ensure that they continue with their examinations without any disruptions, because if you cannot write one paper, you will have to write that paper next year. And we don't believe that that is the wish of most or many, if not all, of our candidates. Remember, we've got a large number of them, about 735,000 of them enrolled this year. So we want a smooth examinations. Those that can get the vaccination done on them, they should proceed and do so. But we are saying to them, be mindful of the period we are in, and take good advice and make sure that you proceed cautiously.
So are you discouraging grade 12s from getting vaccinated just in case they might get some side effects?
It's a possibility. They might as well still go to get a vaccination once they're done writing the examination, because the vaccination program will still be there. We are advising them that they need to do your research if you have the time to do that. We encourage you very strongly that you need to get the vaccine. But if you can wait until you are done with your exams, do so. We have seen others already today going out to the vaccination sites to get vaccinated. No problem with that. As we've indicated, the side effects affect different people in different ways. The position is that all eligible young people must go get the vaccine, except that now we're at exam and assessment time for all our learners in the education system. That's why the vaccination is not being done in schools, because of the logistics involved in putting together an arrangement of that magnitude.
Is this messaging consistent with the Department of Health that children must proceed with caution because of the side effects?
Well, it is consistent with the message that government has been communicating, that everyone in the country must get the vaccine. We are not saying they must not go get it. We are saying that we encourage them to go get it because we need to stabilize the basic education sector. And the only way we can do that is to get as many of our learners who are eligible to get vaccinated. But we must not also lose sight of the examination that is ongoing right now. That's why I'm saying, if possible, work with your parents, get as much information as possible. The Department of Health are always available to provide information. Access those platforms where the information is available so that you are able to make an informed decision. The vaccination program will still be there even next year. The vaccination program is there now, open as of today, and we've already seen some young people going through. There are many who are eligible who are not at matric level, and they are in their millions. So if those ones were to proceed to the vaccination sites, we would be able to make a lot of progress. Those that are in matric, there are only 700,000. So if the rest of them that are between the ages of 12 and 17 could go to the vaccination sites, it would make a massive difference. And that's exactly what we want to see.
All right. So you can't help the grades 11 going down at the schools? Because the schools
Not
are a
at the
convenient...
schools, not now.
But that would be a convenient place, wouldn't it?
It would be. In fact, that's the ideal place to do that, except the timing now does not allow for such. Normally, in the basic education sector at this time, we don't allow any school-based activities because they run the risk of disrupting the work that is being done there. We're preparing end-of-year reports. Assessments are also underway, and there's a lot of focus that is required at our schools. So we believe that the meeting that we are going to have with the Department of Health on Friday is going to assist us to come to a finality in terms of the plans that we are going to roll out to make sure that as many of our young people between the ages of 17 are able to access the vaccine and get vaccinated.
All right. And what are you going to do about educating and giving children an informed choice? Because sadly, there are some parents who probably are going to get in the way of this.
Well, they shouldn't. We have a history of administering these types of initiatives in the sector. We have something we call the Integrated School Health Program. And in there, we have the Department of Health, Social Development, as well as Basic Education. We work together to make sure that all our young people who should be accessing healthcare services in school are able to get that. And there's even a form which has been done years ago. It continues to be used for purposes like this one, to ensure that we create awareness among our parents, we obtain their consent, and we actually invite them to accompany their children to witness what is happening to them. So there is nothing that we do behind dark corners, or there's nothing that we do that parents don't already know, and that we don't force anyone to do anything. Choices, it's always important. So people need to know that the department, the government is not going to force anything on their children if they don't want it. So the right to choose is paramount to us as well. That's why we feel that it's critical that our parents play a role in talking to their children about the importance of vaccine, doing research at home, discuss the role that vaccines are playing in restoring the different sectors to their normal shape and form as we've known them pre-COVID times. So we expect that all stakeholders will play their part and ensure that all those that are eligible get vaccinated and that we are able to return to normalcy in the near future.
This all sounds great on paper, but we know how parents can be, and children, particularly the ones that are a little bit more mature, 16, 17 years old, might be a bit more informed than their parents, and they want to get vaccinated. Parents are being misinformed. Are you going to be the person in between these two, or are you going to disallow an informed child from their human right?
No, they should be able to exercise their right to get the vaccine. We experienced a lot of hesitancy during the teacher vaccination program. And the vaccination program, in fact, that took place in the basic education sector. But eventually, we had over 90% a vaccination rate in the sector. So that is an indication that initially, in every case, there will be hesitancy. But later on, people will realize that what they were taught or what they were told or what they heard was actually not the correct information. And as more and more people make it to the vaccination sites, they too will follow. And we expect the same to be the case. Even with schools, Peter, when we reopened schools after they were forced to close in March last year, many parents said, no, we are not sending our children to school. We don't want them to die there. But some parents said, no, we think it's the right thing to do. We'll take our kids back to school. Before you knew it, our schools were full again. The attendance was good. Even in August this year, parents were hesitant about returning all their children back to primary school. They were hesitant in the beginning. After they saw that others were going back, they also returned their children back to school. So it works like that. It's human nature. You never get 100% coverage in anything, but you try to at least get a good rate in terms of the turnout. And in this case, we believe it will be the same because the coronavirus in particular and the vaccines in general have been a topical matter in the past few months in the country, such that a lot more is known about it than months before.
All right. So you're not contemplating the need for a vaccine mandate anytime soon?
No, not yet. Not yet. We haven't thought of that as yet. Anyway, we have not seen our learners going out. I mean, it's only day one today.
Yeah.
And we know that once it's brought to school premises, and we believe that will be the case when we are ready for that. We'll hear, of course, on Friday what the final decision is on how it's going to work. But if that were to be the case, I can tell you now that you're going to see large numbers of children who have permission to get vaccinated from their parents. It's a large system, but we believe that the majority will come through to get vaccinated.
All right. And around all of this, of course, are many adults, teachers, markers that are going to be involved. So are you happy that enough have been vaccinated and that will be protected, particularly during the marking time?
Absolutely. I mean, the fact that we started on the 23rd of June this year with educators, it was for exactly that purpose, because they handle multiple tasks in groups in the basic education sector. As you indicated, we have markers, we've got invigilators who are responsible for the learners. And we believe that having started with them, that would have given confidence to parents and learners to see that actually this thing is not as dangerous as some people on social media are saying. It's actually a good thing for us. Our teachers are more confident now in going to school. The attendance rate has gone up, absenteeism has gone down among our teachers. So that shows that it has really helped to stabilize the sector, deal with the fear factor, and help everyone to focus on the core job that people are supposed to do, which is teaching. If you're a teacher and as a learner, you go to school to learn. And we've been seeing that. And we have seen a huge improvement in the number of schools that were being closed and reopened because of COVID cases. We're not hearing as much of that, partly because of the fact that most of our people in the basic education sector have been vaccinated. So there are benefits, many of them, to getting vaccinated. If you are doubtful, please look around you and see that it has actually done a lot of good for us. That's why we're where we are today, and that's why we're slowly and gradually going back to the way things used to be. We are not out of the woods as yet. We are still required to wear our masks, keep social distancing, and washing our hands and sanitizing at all times, and making sure that we comply with all the health and safety regulations insofar as COVID is concerned.
And that's a good message to end the conversation on. Elijah Mhlanga, thank you very, very much indeed. And we wish you the best of luck with this very busy season ahead of you. Thank you so much for your time.
Thank you so much. Much appreciated.